This amendment, Mr. Chairman and members, that I'm offering along with my colleagues, Ms. Clark and Ms. Pingree, would prohibit ICE and CBP from detaining pregnant women except in extraordinary circumstances. My colleagues and I offer this amendment in response to the horror stories about the treatment of women in detention centers. Unfortunately, we know these horror stories about women being refused prenatal care and not given timely medical attention following a miscarriage that was likely induced from the stress of being detained. Before I continue, I'd like to enter into the record, Mr. Chairman, this letter, which has been signed by more than 250 organizations and really highlights the atrocities that pregnant women in detention have faced. I'd like for unanimous consent, Mr. Chairman, to insert this into the record.
I'd be happy to insert it in the record.
Thank you.
Not sure where the record is, but it'll be inserted.
Something. Maybe
hopefully someone's taking notes up here. So.
I'll leave this letter.
We'll be done, Ms. Lee.
Inclusion. Thank you.
Yeah, thank you.
Now, this past March, the public was informed about the Trump administration's new, very inhumane policy, which was enacted on December 14, 2017. It's Directive Number 11032.3. Want to make sure we know what that number of the directive is, because this eliminates the presumption that ICE should not detain pregnant individuals except in extraordinary circumstances. Many of us visited detention centers very recently, and I can tell you firsthand that the conditions there are awful. Now, as a psychiatric social worker by profession, I know that undue stress of detention on an expectant mother is not physically healthy nor mentally healthy. But don't take my word for it. Here are a few stories about some of the women who survived their treatments in detention and were able to share their experience via written affidavits. One young woman, and I'll call her E, she's 23 years old. She was held in a detention center in San Luis, Arizona, when she found herself bleeding profusely and begging for help from staff at the facility. She was 4 months pregnant and felt like she was losing her baby. Despite E obviously miscarrying, she said she was not seen by a medical professional until nearly 2 weeks after she had started miscarrying. This was more than a month and a half after she was first taken into custody. In written testimonies taken by the Refugee and Immigrant Center for Education and Legal Services, signed by the women under penalty of perjury, 2 pregnant women held at the Carnes Center in Texas complained of not being provided with adequate medical care for their pregnancies. In addition to lack of prenatal care, one woman said that she was given clothes that were so small for her pregnant belly that these clothes gave her welts and pain in her uterus. The other woman said she underwent repeated x-rays despite guidance from the Food and Drug Administration and standard medical practice that pregnant women not undergo x-ray scans. While these stories are awful, I also want to point out that several medical and mental health organizations, including the American College of Obstetricians and Gynecologists, the American Academy of Pediatrics, and the American Academy of Family Physicians, have stated their strong opposition to detaining women who are pregnant. They oppose this policy change, citing the significantly adverse effects of detention on the medical and mental health of pregnant individuals and children. Despite ICE's claim that it provides comprehensive medical care to those in custody, reports and complaints filed indicate that while detained pregnant women have been forced to give birth in shackles, Mr. Chairman, they've been delayed access to prenatal care, they've been denied breast pumps, and lacked adequate access to health care providers. Now, in making this inhumane policy change to detain pregnant women, the Trump administration has chosen to completely ignore the significant risks that detention poses to mothers and their unborn children. I believe it is up to this committee to change this wrong. The bill before us already provides a $28 million increase to accommodate 19,000 more daily participants in the Alternative to Detention program. I see no reason why ICE should move away from its previous policy of finding alternatives to detention of pregnant women. That's why I urge my colleagues to support my amendment, and I thank you for your consideration.
Thank the gentlewoman for her amendment. Chairman Yoder.
Thank you, Mr. Chairman. I rise in opposition to the gentlelady from California's amendment.